Thank you. I appreciate the opportunity to share a little bit about the work that we're doing in Senegal to address the burden of cervical cancer. So a little bit of background. Senegal has the 17th highest incidence of cervical cancer globally, and this is driven by limited access and uptake of cervical cancer screening. Patient navigation is an evidence-based approach that is designed to reduce barriers to health care. It employs a person-centered, culturally responsive model, and it leverages trusted community health workers to navigate patients into care. Implementation science is an approach that adapts an evidence-based intervention like patient navigation to ensure a successful deployment of said intervention. So the project that I'll talk about today is an NCI-funded implementation science project designed to adapt and implement patient navigation program to increase cervical cancer screening as well as HPV vaccination and ultimately reduce the burden of disease. It's embedded within Senegal's community health system and is designed to target barriers at multiple levels, so at the individual level, at the health post level, and even at the community level. Our navigators are trusted members of the community, the Bajanago. These are women, older women in communities, both in our rural and semi-urban regions that navigate women into care, as well as navigate them into screening and provide education on cervical cancer prevention. This is work that is part of our longstanding research partnership, obviously with UIC, as well as the University Cheikh Anta Diop in Dakar, and the Senegal Ministry of Health and Social Action. So I want to share just a little bit about the work that we've found thus far in we're in our wrapping up our third year of data collection. Not surprisingly, we've seen significantly low screening uptake, particularly in the rural regions. There's limited awareness amongst the participants with respect to the available screening tests as well as HPV vaccination. There's, importantly, limited autonomy on the part of women to make decisions about their health care and decisions for their family with respect to health care. So, for example, HPV vaccination for their children. We identified high levels of cervical cancer stigma, as well as misinformation around the HPV vaccine, and also identified important training and communication gaps that we're addressing in the adaptation of the intervention. So what are we doing right now? Well, we're adapting screening delivery systems to particularly address the low access in the rural areas. We're implementing screening navigation programs to reduce stigma, misinformation, as well as increase women's autonomy. And ultimately, this work will provide the evidence needed to develop scalable patient navigation programs for deployment in other parts of Senegal, as well as similar contexts in low and middle income countries. Thank you.